Hi, I'm Art Bailey. This is the IMT curriculum, Musculoskeletal Alignment. The purpose of this curriculum is to give you a new tool, hopefully to correct people's structure more than you've been doing. What so often happens to us is people come in and say, my neck and shoulders are killing me, my low back is killing me, and could you just work on this area? And yet that's not the cause. And one of the cardinal rules in structural work is don't chase the pain. If you do, you'll never get to the bottom of it. And then we're just totally overwhelmed with structural analysis. So what we're looking for is a recipe that we can apply to the majority of people that walk in the door and get a very good result. The person should get up and feel straighter, their shoulders should feel loose, their back should feel better. It shouldn't matter what their overall pain issue is. One good curriculum can cover the majority of those problems if you know how to apply it. And that's the whole point of this curriculum, to teach you a recipe. A famous body worker once said, get them straight. If they quit hurting, that's their tough luck. That was a very profound statement, and it really got me to looking at structure from that aspect. People are so bent over. They come in, majority of people are humped over, their head's too far forward, their back is bowed, and they're hurting from head to toe for these reasons. They have fallen arches, the legs are too tight. You name it, it all has some correlation. So if they come in with foot pain, knee pain, low back pain, neck and shoulder pain, it doesn't matter. I find that this overall curriculum gets a substantial amount of relief. And that's what it's really about. If you're a body worker and you really care about people, you want to be able to give them some lasting relief. You don't want them coming in every week for the same chronic, miserable problem. So my goal is to get them straight, get them to quit hurting, and then educate them how to continually keep it that way. So what I've done is created a unique system of bolstering and a methodology of working. And I've taken these ideas from everybody that's out there. All the great people that are out there have been just putting out information, and I have a God-given gift of synthesizing information. This is what I do as a teacher. I've instructed martial arts professionally for over 20 years, and I use the same concept. I take principles as opposed to techniques and apply those principles in a systematic way that makes sense. It shouldn't be mind-numbing. What are some of the things that we can use to help us? Well, I have a system of bolstering that's been developed, and that bolstering is unique, and it saves you hours of labor and time. I try to think outside of the box. Some of the other things I do is I use hand tools. Here's a hand tool, just a beautiful hand tool. Michael Daniels makes these. They're hand-carved stones. And this is not one of those spa massage hot rocks. This is an actual tool. And you can put it in water and heat it. You can put it in ice and cool it. And it's spectacular. I can't tell you how wonderful this tool is to use. I have injuries in my hands. I had physical therapy for a year. I was told I wouldn't be able to use my hands more than 50%. I had a reconstructed left hand. But I tell you, I work long hours, and I use these tools, and they are a lifesaver. This particular one has just a wonderful design. I think God just inspired Daniel how to do this. Here's another one that he has, and this is more of a, I call it a hand chisel. And they come in different types of rocks. Those are jade. I think this is travertine, and then they also come in stones like marble, jasper, and they're just beautiful pieces of equipment. I can't tell you how much I endorse this. And I'm one of these people, like my mentor, Paul Harvey. He doesn't endorse anything that he doesn't use and doesn't like, and I always appreciated that. And I said the same thing when I got into my own business. I don't endorse anything that I don't use and that I don't like, and so I endorse these, and I admonish you to use these. And we'll be using these in the curriculum, and I'll also show you how to use your hands more effectively. Because of my hand injuries, I have to use my hands more effectively, otherwise they're just going to hurt all the time. And you have to work deep, but you have to work effectively. So the key to what I try to offer you is how to work smarter, not harder. I'm trying to give you a recipe that really works, and if you follow this recipe and then add your own twist to it, again, don't get strung out with my techniques. Use the principles and the concepts. Get them straight. If they quit hurting, that's their tough luck. One of the primary things I believe that people have so much pain from is the core energy of the body is just sucked out because of postural distortion. It takes a lot of energy to stay distorted and feel bad in the typical upper cross and lower cross syndrome. Our shoulders are rounded and our back is bowed and kyphosis. We have a lot of lordosis in our back and our hips are displaced, and that you have anterior rotations. And this is just a quagmire, and it takes a lot of energy to keep the body distorted like that. If you take that energy and give it back to the body, your metabolic rate increases, your breathing improves, your cognizance improves. So many things will improve. When your client gets off the table, they'll say, I haven't felt this straight and this well in so long. And they'll recognize immediately a profound change, and that will keep you in business. Guaranteed, people will keep coming for that. They'll tell everybody about it. You won't have to advertise. When you do this kind of work, it's a fact. They'll be beating your doors down because this is what people are looking for. Massage is wonderful. Relaxation is wonderful. But the majority of people have some kind of a pain issue, and it's just chronic and ongoing, and they just feel so defeated because that is the misery of their life. And you take it away and educate them how to keep it. Now here's the key. Educate them how to do it. There's no vested interest in having the same person come in every week for the same chronic problem. If I had a car like that, I'd be suing someone. Have them come in once a month for maintenance. That's as much as they should. After you've taken them through a regimen, they get some straighter, feeling better, then put them on a maintenance plan, and you'll have more business than you'll know what to do with. So again, don't get caught up in my techniques. Concepts and principles are the most important thing. Take this concept and understand it's like taking a car apart or anything mechanical. There's a sequence to the movements. Understand the sequence and how they interrelate. Do the sequence, follow the concept, and use my techniques if you prefer. If you have better ones, use them. And if you have even better ones, send me information. I'll be most happy to use it. I tell anybody, show me something better, I'll steal it. I'll give you credit for it. Actually, we don't steal anything. We liberate it. I have a military background. In the military, you liberate things. Makes it sound like it wants to go with you. Anyway, let's get started with this regimen. And I think you'll find that it's wonderful. It's easy to understand for the novice and for the advanced practitioner. And understand that you are a body worker and you have an intuitive sense about what to do because you love the work or you wouldn't be doing it. We all have this God-given gift. That's why we're called to use those gifts. And those of us that really love this work and do it, we know that is a God-given gift. And just as I have mine, I want to share it with you. So, let's get started. We're going to have some fun. The bench work is optional to the curriculum. You can do it. I usually do it at the beginning. It allows you to get a lot of work done without as much effort on the table. So you can do this work optionally, or you can add it to the overall curriculum. That's why we're putting it in here first. What's nice about the bench work is the person is engaged with you. And as long as you can get the person to engage with you, then you can get more motion deeper into the tissue. Some of the things I'll be using are ointment. One of the ointments I use is something that we manufacture. We call it bear grease. That's a nice affectionate name for it. No grease in it. It's actually a very strong analgesic. Topical ointment has a lot of beeswax in it. It uses comfrey root and emu oil. And it's turned out to be a real winner for us. People swear by how it keeps the inflammation down and how it keeps out the soreness. It gives us a lot of drag, as people that do structural work call it, and that you want deep resistance, but you don't want to take the hide off. So you want a certain amount of drag in the tissue, but you don't want it to be oily. So this ointment has just been spectacular, and it's what I'll be using. Our motto today is Wayne Osworth, and we thank him for his participation. Promise not to be too rude to them. That's a nice way of saying just mean. We want to start out then working these suboccipitals. Now I'm going to be walking over and getting some of these hot structural stones that I had spoken of earlier, and I'll be using those extensively along with my hands. And as I said in the introduction, I'm going to show you how to use the stones and how to use your hands and overall how to use everything more effectively. And that is the gist of this course, to get more work done, get it easier, make it easier on the client, and overall get a lot of diminishment of body pain. So what I have over here is a little heater, and we'll take a moment to pan over here and show you this. And this is just a typical little water heater, and I placed these stones in this water heater, and so it keeps them nice and wet and warm. And there's something about wet and warm that tissue responds better with. So we'll start coming back here, and I'm going to just gently address this tissue. Wayne, if any time any of these stones are too warm, you have to let me know, because sometimes those heaters pick up too much temperature and you just have to keep them adjusted. And we'll work this entire area. Again, I'll be using a little ointment constantly. For most ointments, if you use as much as I use, it would be too slick, but because it has the beeswax, it tends to be a little forgiving. So we'll loosen this up. I'm going to ask you to press your head that is, back against my hand. And I'm going to work into the suboccipitals with the tips of my fingers. At the same time, I can kind of friction the back of the cranium, give it a good scalp massage. Then I can take this stone and do the same thing. I can place one tip of it up here into the levator, and then at the same time, with my finger as a guide, work deep into the occipital region. Now, why are the occipitals, or the suboccipitals, as we call it, so important? Turns out there are 32 muscle spindles per gram in these suboccipitals, as opposed to 7 in the big glute maximus. Now, what does that tell you? It tells you this highly innervated set of muscles controls something. What does it control? Well, it helps in the writing reflexes, keeping your eyes level at all times by adjusting the muscles. And therefore, it has a dramatic effect on the tone of the entire upper back all the way down the back. What I found is you can work these suboccipitals and release quite a bit of discomfort in this scapular margin here. People will say it's real sore between the shoulder blades. You can rub in here and say, yeah, it is. You can work these suboccipitals and find out suddenly this soreness goes away. So that's a really good thing to know. Again, I use these stones as a way to brace my hand, and that keeps my hand from collapsing. Allows me to strengthen my fingers by having a base to work from. And if anytime anything's too uncomfortable, Wayne, you just have to let me know here. And so you can learn to do multiple movements at one time. You can take and friction the base of the skull here, the civitalis, and the suboccipitals. Another profound thing that's been found recently is the subopps actually go down into the dural tube. I believe it's the rectus capitis minor posterior that goes into C2 and affects the dural tube. And that has a profound effect on some migraine issues. When your head becomes projected too far forward and you collapse this area, it tends to inhibit that muscle's ability of pulling back the dural tube. And there's quite a bit of documentation saying how that affects migraine issues. So working these is very profound. Again, using two hands, putting the stone down, press your head back against the wall if you would, and slightly tuck your chin. Just a little bit. There you go. Now, the mistake people make is they usually say tuck the chin and then push the head back. It doesn't have the same effect. Always push the head back first and then tuck the chin. Once you're in that position, stay in that position for me. Constantly focus on the back of your head and your chin. You constantly have to reaffirm to the person what you're doing, so they will do this for you. Also, a lot of people have a tendency of just slouching. Therefore, you ask them, if you would hold the side rails of this bench for me, and they'll just hold on to it. That keeps them nice and square. And then you can work back in here under the trapezius into the semispinalis. The semispinalis acts kind of like the erector of the neck. So you work the subops, you've got them nice and loose, and there are just many, many ways of doing the same thing. I can reach around here, ask him to push back into my hand, using just my index finger, my thumb, and then give a nice, vigorous scalp massage, trying to move the fascia of the scalp and not the hair. And there's a line of tissue, theoretically, that comes all the way from the plantar fascia all the way up the back, basically following what we would call the bladder meridian, right up through this area. And it has a dramatic effect on tension throughout the back plane of the body. So there's no wrong way to do this. Just understand, work these suboccipitals basically from this mastoid process all the way around. Get deep into this. Another thing that happens when a person pushes back, push back again and tuck your chin slightly, they're engaging the longus colli, which is anterior to the throat behind the trachea. And as that engages, it allows you to go deeper into this cavity. And that's one of the exercises that is taught for severe neck injury. It's called a dural tube extension. So engaging those anterior neck muscles. So that works pretty good for us. Next thing we want to entertain is what's pulling the head forward and what's pulling the shoulders forward. Well, the head is being pulled forward by the scalene muscles, the sternocleidomastoid, the falcial sheath that's pulling down anteriorly all the way to the costal margin. The shoulders are usually being rounded by the pectoral minor, the subscapularis, the serratus anterior, the latissimus dorsum. And so what we want to do is pull back what we would call this strap. And this particular strap is a composite of the pectoral minor that comes all the way through, attaches to the scapula and into the lower trapezius. And so this shoulder sling, or strap as we want to call it, is something that we want to pull back. And the way we want to do that is, I'm going to reach up here just in front of the trapezius and pick up under the clavicle, and with a nice strong motion just pick everything up and drag it back. If I feel too much resistance, then I'm going to add a little heat to it to soften the tissue. So since I'm feeling so much resistance here, I'm going to add a little ointment and a little more heat to soften this area. Put a little ointment in here. Again, you have to feel the tissue. If you need more resistance or less resistance, you can add more ointment, more heat. And the fascia will soften rapidly just by using heat. And as you can see, we can loosen this using one of these stones, and now flip it around and use the edges of it under the edge of the scapula here. And I'll work all the way down the back, just this entire length. And kind of let these stones fall into place where they will. You'll find they just fit right around the grooves of the bones and the tissue. Always remembering for kyphosis, you always bring the tissue lateral to medial, since everything is brought forward. Okay. And again, I want to reach around and capture under the clavicle and across the trapezius. And I'm going to ask you to place your hands on these rails for me, and that's going to keep him real square. Just kind of relax, holding on to those rails. And with a real good archer stance, I'm going to drop all my weight down through my leg. Again, I've switched stones and I've gone to the other side, and we want to get a little more of this angle. And like I said, we'll work the neck, keep the area up, work under around the scapula, all the way down the back. And work lateral to medial, bring the tissue in. Reach around the front of the clavicle and arm drag at the trapezius and physically pull everything up and back. Up and back. Just slowly let that work. Again, don't just drive hard bony parts of your elbows into people. Let the tissue drag. Give it time to move. Okay? And that's pretty much pulling back this shoulder sling. That is that connection between the pectoral minor and that trapezius. And it just acts like a sling, a strap if you would, that pulls forward. This next procedure is moving the costal margin. Why is this important? The costal margin is this area where the ribs come together, and it is the theory that it's one of the most important areas of the body because most body flexion gets locked here. The diaphragm bisects the body, the rectus abdominis attaches here. The diaphragm has a set of muscles called crura that come down into the lumbar. One's longer than the other, tends to shorten and twist the entire torso. People's breathing habits get tight, it tends to twist, and this is supposedly the beginning of so much body distortion that causes the back to bow, and then the compensatory pattern for that is the upper body will be more kyphotic. So what we're going to do at this point, it's also said you cannot get the head to release going back unless this is released because of the fascial connection between these two areas. What I'm going to do then, Wayne, is ask you to place your hands on top of your head for me. And again, I'm going to warm this area up a little bit. And I'm placing my hand onto his back to give him good support. Start right here at the outer lateral edge and ask you to slowly turn toward me. And as he does, I'm just going to let my knuckles rake right through here and come back to center. And again, now I'm using stone and the bottom of my hand, that thenar eminence around my thumb. And again, I'm just following the contour of the ribs. And because it's nice and warm and wet, the fascia loosens up. And because I can go deep underneath the ribs, I can get a little penetration through this front. And I can do that to both sides. Again, I'll switch stones. And I'm constantly switching stones because the heat is being dissipated by the body. Put the ointment on. Reach in here and warm it up. Find the area that it feels most comfortable and ask him, rotate toward me. And take your time doing this. And again, as you can see, I'm showing you different ways of doing this. I'm using my thumb at this point, going under the costal margin, using the stone to follow up with. And then I can use the base of my hand, and I can use my knuckles. You have to figure out exactly what gives you the best resistance. The concept is bring everything to center at this costal margin. Okay? And that is releasing the costal margin. Next thing we want to do is to push or pull back this motor cylinder. The motor cylinder is comprised of approximately 13 muscles, depending on how you're counting, but they usually are all the muscles attached to the cervical vertebrae, allowing this head to have all this nice motor function. Of course, the sternocleidomastoid, the SCM, and the scalenes are the primary muscles that are keeping your head forward. That, and of course we just said that costal margin. So what we'd like to do is move some of this back now that we've released some of this margin. It's important to note that, of course, you know the blood supply behind the SCM, so you're not jamming directly into the neck. Instead, you're going to be shearing back across the muscle all the way into the suboccipitals, and they're going to be moving for you. So you will explain to them first, always show them how to move. Wayne, I'm going to ask you to keep your head level and rotate. Let me move your head just like this, okay? And when you rotate like this, you'll be also concentrating this area right here. As I push through that, my knuckles will be going in there, and I'll be using a tool into that suboccipital at the same time. Again, if anything's too uncomfortable, it's important that you let me know. So again, we put a little ointment in here. I'm going to take the back of my hand first to get him acclimated to it, and place it right in front of the SCM, and ask him slowly turn to your right. And he will rotate, and I will continually drag my hand and my knuckles with a loose palm right through the back of the occiput, and I can carry this out with my entire arm all the way until the elbow, and then drag it down, and I'll just follow all the way down around the border of the scapula when I do this. Okay? Now, another way of doing this to get a little deeper is I'm going to reach in here and use one of these stones. This is that little hand chisel that I like using. And the same thing. The back of my hand, I'm going to reach this hand chisel back here around the mastoid process. Okay? Stay off the styloid process, of course. So as he turns, I'll be able to go a little bit deeper in there. And again, allowing the heat of this stone to lay into the tissue. As you can see, I'm just going to let it lay into the tissue. And again. So that's one way of doing this. You can do the same thing using the stone or anything for hand support, and use just your fingertips again. And so you can't work this area too much. And again. If it's a fairly stuck area, you can ask him, turn back to me, get a little more engagement, and turn. Turn back to me, get a little more engagement, and turn. And back to me. Notice how my hand keeps taking up the difference, but my arm maintains the connection the whole time. Okay? That's one way of doing it. There are so many ways of doing the same thing. You can take the back of your hand, starting here, bracing off across myself, and turn, and just pull and pull. And when you reach the mastoid process, bring your knuckles in and work this suboccipital region. So there's no really wrong way to do this. Some people prefer to take the base of their hand, and the same thing, and turn. And this is one of those things that you can teach your client to do for themselves. He could take his hand, would be in the same position, lower finger, at the clavicle, and as he turned, his head would do the work, and his hand would just naturally roll right around the neck. And that's a good way to loosen up. You'll be working the scalenes, the SCM, some of the spinalis, and splenius, everything at one time, because you're really working the fascia. And as the muscle's engaging and you're going across the muscle, it has a tendency to soften it. There's a concept of working 90 degrees to a muscle to loosen the subcutaneous fascia. Next movement we want to do is we want to work on some of the muscles that are pulling the shoulder forward, such as the serratus. And if you'll place your hand on your head for me here, the serratus anterior has a tremendous amount of pull, and it's usually overpowering the rhomboids. And you'll know that by this rounded shoulder effect that people have, just really no definition in the shoulders. So you'd like to pull this back, and there's several ways of doing this. Again, depends on how much friction you want to achieve. Stay out of the mammaries, but go right into the edge. You'll feel where the tissue starts right here. And of course the serratus goes from here underneath to the medial border of the scapula and helps bring the scapula forward. So again, warm up the tissue, work it a little bit, and you can go 90 degrees to the tissue. It has a way of releasing faster. Okay. And you can use the palm of your hand, and you can physically pull. You can brace your hand into your body, and you can pull across, coming up into the rhomboids. Again, bracing solid into your body allows you to do this. Come right across the scapula, and you'll be picking up some of that latissimus at the same time. All the way to vertebrae. And then you also have the choice of levering this back. I kind of place my body next to his arm, pinning it here. I'm going to ask you to hold on here for me. I'm going to just pin, bring this arm back up, or reach across. Now, on some people you can do this comfortably, on some you can't. Depends on how big you are. I'm going to reach right here and capture, and twist and pull. Reach in here and twist and pull. And I have enough physical strength where I can do this. Some people cannot. And you can just get right under the edge of the scapula here, and then just drag the tissue back. And as you can see, I'm levering the arm up here. So if you look up to where my hand is at his elbow, I've got this, and I'm just levering the entire body back. So that's one way of doing this. There's several ways. The concept is, take the serratus and move it back. Some people do it with two fists. They'll come in here and just drag this tissue together. Now, that's not as easy for everyone to do. So I find it's easier to do one side. Okay? And that's what you're trying to do by moving the serratus rhomboid. And this is the other half of the sling that we were talking about. Kind of forms an X. The sling goes from the pectoral minor down into the trapezius, and then the rhomboid comes through all the way into the serratus anterior. That forms this X. And just imagine that X when you're working the tissue. Next, we want to focus again on the scalenes. Notice that we're going back and forth from the muscles that cause the forward rotation in the shoulders to the muscles that pull the head forward. So now we've gone from the serratus anterior, loosen that a little bit. Now we want to go back to the scalenes again. And here, if you can remember your anatomy where these scalenes are located, the SCM, you can find it easy enough in the mastoid process. Go directly behind it, and you'll be to the anterior scalene, and follow that across to this trapezius, and you'll cover from anterior to middle to posterior scalene. I'm not so interested about getting the individual muscle as I am the area, but I am going to use my thumb right here to give me a guide behind the SCM. So I'm going to take the head here and ask him to slowly bend as he does, rotating my hand. And again, I'm using one of these stones for a hand support. As you can notice, it gives me a solid fist and a hand support. And I can use my knuckles. I can use the edge of my hand. I can use this tool in the same fashion, holding it in my hand just about like that, and reaching right here and then pressing and just dragging. I use my fingertips. I don't care how you do this. Just understand the concept is to drag these scalenes down. Okay? Okay, after we have worked the scalenes, and again, I'm not going to do both sides every time that I'm working. Most of it is just to get past the amount of time it takes to show this video. But of course, you'll be working the body bilaterally. You'll do one side, you'll do the other side. We're really giving you the best camera angle, the best we can. Since we have a limited amount of space in here, we're going to go for the best camera angle, understanding that you're always just working really both sides, even though I'm showing one side. Next thing we want to do then is to lever back the humerus and its attachments. And to do that, I'm going to reach up here and capture the arm, and my elbow is going to sit somewhere right around this trapezius, where the levator comes into the tip of the scapula. And I'm going to reach around to the pectoral, and that is to the pectoral major, and just kind of compress until I capture into it, bring the arm across and back toward me. And you'll try to stay nice and square and let me just pull this back. This comes across and back to me. And so this supports the arm. And remember, if the arm has any kind of damage and it feels weak, then lock your body into it. Just physically lock it next to your body so they feel secure. But you're trying to lever back the pectoral, and you're trying to push down on that trapezius with your elbow at the same time. Now that normally is painful either way. If you just lever back the pectoral, it's painful. And if you drag down into this complex through the rhomboids, through the trapezius, that's usually very uncomfortable. But if you do it at the same time, they tend to negate each other. So, you know, it's that thing of stomp on my foot and I don't feel my bad finger. And I will give you another view of this. And again, I'm pretty much grabbing right in here on that pectoral. I'm not going to dig deep under here, as some people will, to affect the pectoral minor, because you can do that on your table. You can do this, again, if they're willing to live with it. You can reach in here, hold close to the ribs to stay off the lymphatic system. Allow the arm to come in so that you can reach deep up underneath it, and then start levering up. And you'll feel those slips, those 3 slips off the pectoral minor at some point. We'll start pulling. This can be fairly uncomfortable. It's important to know that and how much the person's willing to work with. So really, I find if I just clamp right through here using a knife edge, my hand, and then lever back, I get pretty much all the leverage that I'm trying to accomplish. Okay, the next movement then, we want to go back to the neck again, and we want to work these scalenes. Now, what you don't want to do is dig deep down in here, because there's a minefield of nerves. If anyone doesn't know that, go back and do your anatomy study. Your brachial plexus will be right in here. So how can we affect these scalenes and really go deep into them? Because you know they go up underneath the clavicle, attached to the first and second rib. Well, how about if we use the clavicle itself? And here's one thing we can do. I'll brace my leg here. Let your arm fall. Just let it hang. There you go. And as you can see, that creates this void. So I'm going to reach around and hold on to the clavicle. And I'm going to ask him to bring his head toward me. And now reach in and just pull into the clavicle. Okay? And then slowly move the head away. Again, you have to tell me if it's too uncomfortable. And what I can do with my fingers, I can dial my fingers, just like I'm playing a piano. So I can go anterior, middle, posterior scalene. Depending on where I feel the tension, I can dial my fingers into these scalenes and stay off the brachial plexus. As long as I'm pulling into the clavicle itself, I'm basically restricting the fascia. And Wayne will tell me, yeah, that makes me feel like my ear is being pulled off. I'll slightly rotate the head a little bit to get another angle. Rotate toward me. And you'll be able to feel the tissue come up underneath whichever finger you're pulling toward. And then come all the way to me, reach a little bit deeper. So you can go quite a ways into this area. And the key, of course, is get this arm up, have them hold into you because they're going to want to move away from you, and slowly release. Now this is a really good place to talk about breathing. The breath you want this person to use is the ha breath, H-A. Nobody really breathes out like they're blowing up a balloon. You ask people to breathe and they go, well, that's not a natural breath. That just evacuates the upper lung. To really breathe, that's a full breath, upper and lower lung. So to truly relax, tell them to breathe out using this H-A syllable. Okay? And that will help because this area can be such a minefield. And if it's too hard for them to trust you, you will ask them, I want you to move away from me as far as you can, and just twist your head until you pull into these different places, until you feel this area pull. Just move your head back and forth. And at whatever level that you want to deal with, so you're hurting yourself, you can't blame me. Okay? At the same time, you can reach across while he's doing this, and again, you can friction through these scalings and get multiple sensory perceptions at one time, and that will keep it off from hurting as much. Okay, and again, if you want to use a hand brace, I constantly use these little stones. You can use the head of this stone. While he's doing this, just keep bending back toward me and then away from me, and that lets me go a little bit deeper down into that clavicle. Same thing, what we did earlier with the stone, and that is drag through the suboccipitals, just rake the tissue away, rake it away. And you'll feel all of this release, okay? And that's a really nice way to release those scalenes. And we better do this side or he's not going to like us. Same thing. Drop it here, drop it from here, reach right into here, and bend away for me. Back and forth. As he bends, I'll pull. And again, this ointment is spectacular because he's not going to be near as sore as a lot of people get from doing this work. It has a wonderful analgesic effect. It uses menthol, does not use capsaicin. So, it tends to stay cool, never have a burning sensation. The emu oil is a transdermal carrier. It helps to carry the ingredients a little bit deeper into the tissue. The comfrey root is an anti-inflammatory along with the emu oil. And we've just got a great formula here that a lot of arthritic people are coming in really saying it helps them. So I'm glad that we've been able to put it together. I just took several old formulas and put them together and came up with something just a little bit better. I don't make anything up. I just take what's out there and try to make it better. And that's what any good therapist does. There's nothing new under the sun. These techniques are not new. It's just the concept of how to do this. Okay? Okay, next thing we want to do is distract the scapula. Now what a lot of people do to distract the scapula is they drop the arm back and they fold it behind the person's back. But what you'll notice is how tight the anterior deltoid muscles get when you do this. So it's not really comfortable for a lot of people. Okay? So what I find is, using the other arm, because you'll get a better view, just relax your arm there, is if you'll take the hand and face it forward, and try this on your table also, slightly bend the elbow. I learned this by having people just grab the seat, and it was a good way of them working. And if they do that, and I slightly rotate the person, that tends to make this area more accessible. And so from here, I'm going to hold the front of the shoulder and slightly elevate it, keep it cupped in my hand, and rock it around until I can basically go underneath the scapula. And just rock it back and forth. Allow this to happen. Now a lot of people, I can work the border all the way up to the tip of the scapula. And that has a profound way of loosening the back. Now, one thing I want to do is be able to create a little more leverage. Once I get a hold of this area, I want to get some leverage to where I can really work it. And I'll do that by placing my forearm across the front of the shoulder, underneath the shoulder, not on the corporate process, and the back of my hand levered against the back of the neck. And it looks kind of like this. So here's what I'm doing. You see me open up the back of the scapula. I'm going to pick up the arm, as you can see, with the soft part of my arm. Just reach around and pick it up and lever against the back of the head, and then slowly rock the body. A lot of times I will ask him, turn your head toward me. There you go. As he looks toward me, that makes it a little bit easier. And so I'm not just trying to rip this scapula off, I'm just kind of rock into it. And again, you can do something like work the suboccipital at the same time. Turn your head to the left, and to the right, and to the left, and to the right. Notice that I'm using the knife edge of my hand, placing it right into the suboccipital region. He's turning his head to the left and right, and I know for a fact, keep doing that for me, turn your head to the left and to the right, just kind of sawing the base of the skull. And I know that the receptors in that area will help loosen this lower back. So I'm kind of using those proprioceptors to help loosen this tissue. And I can go all the way up. Okay, so that's a really nifty little way of doing that. Next thing then we want to do is take this entire line now. We've loosened up the motor cylinder, we've loosened up some of the front, and we want to pull everything back down because we're all bent forward. We want to bring this line back. So the entire back plane needs to be brought down. And we'll do that with some good bending exercises. So again, we'll reach out and capture a stone. And we're going to put a little more ointment in here. This organ has a tendency of really getting into the tissue. And I think Wayne will agree it feels pretty good. So what I'm going to do is two things. I'm going to find the edge. This stone has a unique point to it, and I can physically reach in and get close to the edge of the spine. Now what I do is I use the tip of my finger as a guide so I don't jam it into the spine, but I can get real close to the lamina groove using the tips of my fingers as a guide. So I use the back of my hand as we start out by moving the motor cylinder, and I'll be coming across the neck, and in one continual motion then pick up the stone and keep this motion continuous so that I never lose grip with my arm and go all the way down. And what you'll explain to them is you'll keep your feet out solid in front of you, your head is going to start bending, and then your entire body will bend at the waist, and you let your hands fall down to the side, just releasing your air. Okay? So I'll start out here, and first I'll say tuck your chin and slowly bend your head forward. Now roll your head forward. And again, I'm doing that same work that we did for the motor cylinder. Now I'm picking up trapezius. Now my arm is turning. I'm going to place a stone in the thoracic and close to the edge of the spine, and let my arm drag the entire length. Let your hands drop in front of you. There you go. When I run out of that, I just continue this all the way down. A lot of times then when I feel the crest, I will just fall into a slot between the crest and the ribs. Okay? Doing the same thing again. And here's where my hand's coming across. Then I reach over and I pick up this stone. Now I've got a solid grip. My arm is constantly in contact with the tissue. Comes all the way down. And so the heat from stone kind of acts like a plow that's breaking up the tissue in front of me, and it makes it much easier to work. And again, making another pass, coming through with my hand. I keep my thumb out a lot, you notice, and that tends to be kind of a guide for me in the tension I can keep in my hand by where I put my thumb. I'm going to reach out and capture this stone. And Again, it's plowing, as you can see, just like that. Any number of ways to do this. And see, I've switched it from one hand to the other. And I'll show that again. Reach up and capture. And this is where you don't want to let it go. Makes him feel like he's getting a facelift. Capture the stone. And I'll get my hands out of the way a little bit so you can see. At this point I know exactly where the edge is, so I'm not using my fingers so much as a guide. But if you're not comfortable with this, always use your fingers as a guide. Do not just let this thing dig in here somewhere. Okay, so you know exactly where you are the whole time. And you want to do this pretty much on both sides. And this is stripping the erector. Okay? The next thing that you want to consider doing is adding some movement to this. And you can do that something like this. You'll place your hand on top of your head and reach back here and give me this arm. So as he bends, I'm going to take my knuckles and follow the spine. And he'll go down. And I'll twist and follow the spine. There you go. And I can do that with my arm just as well. Remember how I pull back the motor cylinder? And first I'll pull back across the motor cylinder using my elbow, and I continue down right next to the laminate groove. And that nice little twist gives you a little bit of alignment in the spine. So that's another way of doing that. So here we're going to do this with two arms. And at the same time we're going to stretch. Actually, lengthen is a better word. We don't really stretch things. A lot of therapists in several states cannot stretch muscles, so we don't stretch anything. We extend the range of motion, which is a better way of saying that. You'll place your feet out in front of you to where your heels just lock, and you'll tell me when you feel this in your legs. So as he bends forward, he's going to wind up feeling this in the legs. First, I'm going to take both elbows, lock right in front of the trapezius. Ask him to tuck your chin for me as far as you can, and continue real slow going forward and letting myself bend with it. Let your hands fall in front of you. Now I'm using both elbows. When I get all the way down to the bottom, I will back up and find the crest and usually press right across those QLs, right across here. Okay, and that's one way of doing this. So I can use my elbows. This is where the stones are really invaluable, because you can use two different stones to do the same thing. And again, slowly tuck your chin and start bending. Tuck your chin and bend your head. There you go. And pressing right close to the spine. Gives my hands a very solid grip. Again, you'll see that this is what's happening as I stay closer to the end of the stones. Okay. Next thing, while you're down there, Wayne, I'm going to ask you to reach back and hold the bench. You're going to look up toward the ceiling, bending your head, and start arching your back as you come up. Now you can do this for people that don't really have a back problem. It's a very nice extension exercise. Keep coming up. There you go. And again. Go back downward slowly. And come back up. And you can use stones, or you can just use your fists doing the same thing. So same thing, using my fists again. And bending forward. You can lock your hands together, usually grabbing your thumbs. And coming back up. So this is a very powerful movement. So we pretty much covered everything that we want to cover at this point. We started out, of course, working the suboccipitals, and that's really important. And after you got those suboccipitals, then you had to drag back some of this sling, as we call it, between the pectoral and the trapezius. We then went through and we worked the costal margin to open that up. And we went in and started moving this motor cylinder, working the SCM and scalenes, some of the spleni and spinalis muscles back here. We then wound up pulling back the humerus and some of its attachments, and that was fairly important to get these attachments to loosen up. Then we dragged the scalenes, and we also worked the scalenes by holding on to the clavicle. We distracted the scapula, and then we did some deep stripping down the back. One other thing that's possible to do here is to use a piece of equipment that we call a vacuum therapy system. And I'll show that to you. So what I have here is a vacuum pump, and we manufacture this device called a vacuum therapy system, and we use the concept of Chinese cupping. We place one of those cups onto this tube, and this particular cup has a hole in it. So some of the cups we put holes in, some we don't, so we can just leave the cups or we can keep moving it. What's unique about it is that it will allow me to draw tissue and treat this very much like skin rolling, or I can use it like typical cupping and just apply pressure and leave the cup there. I can do what's called running cupping, apply pressure and kind of strip the tissue. I can put a mild amount of pull in here and actually do some lymphatic work. So you can work on trigger points, you can work on adhesions, you can work on any number of things, but you don't have to have that black and blue effect that typical Chinese cupping is very popular for. People don't like it because it leaves you so black and blue. It has a tendency, because it's an uncontrolled vacuum. They put a glass cup, they heat it up, and it draws a vacuum. This allows me to control the vacuum, and it's become one of the most phenomenal pieces of equipment we've manufactured. You can work into this deep restricted fascia in the low back and loosen that up for so many low back issues. You can work into frozen shoulder, which usually has a lot of associated muscles that are bound up at the same time that you have adhesive capsulitis. So there's any number of things. You can even work into the suboccipitals with the smaller cups. And you can totally control the amount of vacuum that you have here. We're going to do it for just a moment. It's a little bit loud, but you'll see what I'm talking about. So I reach here and I hold the cup, and it draws a vacuum. And I can just sit here and just touch that hole, and at the same time I can move it. But it will definitely loosen up some restrictions that people often have. So what I'm doing, you can go all the way directly down the spine and over the spine and pull some of that restricted tissue that tends to bind up on the spine. At the same time, you can ask him to bend slightly. Number of things that you can do with this. The concept is very sound. It pulls the tissue and loosens the tissue up. It draws blood into the area, and if the area is ischemic and painful, blood is a base, and it's going to neutralize some of the acidity in that tissue. So this is one of the more phenomenal pieces of equipment that we've had thus far. So as you can see, we like using equipment. Don't get caught up with the tool. The tool is just something to help you, but you have the tactile resources right here in your hand. Learn to manipulate your hand, let it mold into the person. If you need more support, use a stone, use anything that gives you some hand support, but don't crush your hands. The vacuum therapy system is phenomenal. The ointment that we use is phenomenal. You have to find things that really work and make your work better and or easier on the client. And when you can do this, you'll have a very effective modality of work. So this bench work is optional. You can do it prior to the overall structural regimen, or you can do it by itself. Very often people come in and say, I just have a half hour, can you just do my neck and shoulders? Well, you know as well as I do, you're wasting your time just working the neck and shoulders. If you do this regimen though, you'll be loosening up what's tightening those neck and shoulders. Then you'll be actually addressing it. When a person stands up, they'll feel much straighter, they'll feel much better, their shoulders will be back. Now when Wayne stands up for us, if you'll stand up, what you did not see initially was the measurement that we took. We normally take this measurement off the coronal line. I reach over and I find the little divot that you find where the acromion attaches close to the clavicle. And if you draw a line from that straight to the neck, you'll see how far forward the neck is. Okay? If you'll stand sideways for me, Wayne, that'd be much easier to show. So if you reach in here, just feel, you'll always feel that trapezius comes in. Right here, there's this little divot, as I call it. And that's an easy mark. Follow it, you'll see exactly where the head forward position is and how far forward. That will give you a mark so that when you're done, you can always mark the same spot and see where it is relative and how much back the head has come. Even the little bit of work we've done here, Wayne will feel further back. His shoulders will feel further back. What you think? They feel like they're back a little bit. Yeah. And you don't really have to tell people they feel back. You can tell them, you may feel this. How do they feel? They'll automatically tell you. My shoulders feel like I don't have to just hold them up. And that's kind of how we'd like to keep this. If you turn back for me. So, again, releasing this costal margin is crucial. If you don't get this loose, you won't get the head to come back. If you don't get the SCMs and scalenes to release, you won't get the head back. If you don't get some of these muscles, such as this big sling, to release, you won't get the shoulders to come back. And it's important that you do them both and that you do them sequentially. Otherwise, you loosen up the shoulders and what you'll have is a head that's forward. Or you loosen up the head and you'll still have a shoulder that's forward. And it'll be fighting you. Pretty much is the gist of the structural work to get a person straighter. As that famous body worker once said, get them straight. If they quit hurting, that's their tough luck. And so from here we'll go on to the next section of the structural regimen.